ACT Health Minister Rachel Stephen-Smith has been caught on tape at last week's Labor National Conference giving a remarkably candid how-to guide for radical left-wing activists to effect dramatic change without scrutiny. The Australian Sarah Ison revealed today that the minister had a strategy that was all about quickly and quietly getting what she wanted. In this case, the decriminalisation of illicit drugs, including cocaine, MDMA and ice, drugs that are literally tearing families apart. Let me summarise the strategy for you, based both on the minister's class for activists and the actions taken on the issue. Step 1, make sure the proposal is hidden somewhere in the party platform before an election. That way, after the election, you can claim you have a mandate, even if it wasn't part of your pitch to the electorate or even something voters were aware of. In her words,
we took it to the election quietly, but we could point to our platform and say, it's in there, it's there. So after the election, we were able to work on it quickly.
Step 2, post-election, get it put forward in a private member's bill, not one from government. That way you don't have the pesky due process of working it through as a party of government should. Step 3, misrepresent the work of parliamentary committees to suggest that all parties are behind the proposal, even when they're not. In this case, the minister indicated there was tri-party support for the decriminalisation of these hard drugs when the Liberals had not given a recommendation of that nature. Indeed, the committee report the minister relied upon was one that dealt with youth mental health. Then go on to step 4, exploit a weak opposition and a disengaged electorate, along with your numbers in a unicameral parliament, that's one without an upper house, to ram it through without scrutiny. It's a pity oppositions aren't strong enough at this point in time in some parts of the country to be able to push back on step 4. Step 5, leverage the changes to build an evidence base to support the next, even more radical policy step. In the minister's own words,
it's really about not letting the perfect begin with taking a step, embedding that, being able to then point to that and say, hey, the sky didn't fall in, we can take the next step.
If you think all this sounds a bit conspiratorial, you can look to recent history for validation. The ACT Labor government compulsorily acquired Calvary Hospital against its wishes in an ideological move designed to eliminate faith-based healthcare. It also allowed them to eliminate the last place where a pro-life health worker could hold down their job without being forced to act against their conscience. So, following this minister's strategy, what's the next step? It's euthanasia for teenagers. Then, once the so-called evidence base for decriminalising drugs is to hand, the next step, well, that's outright legalisation of hard drugs. The ACT Labor government might call themselves progressive, but this is not progress. It's cynical, destructive to the human condition, coercive and wrong.